Thank you, Chair Tester, and thanks to our witnesses for being here to discuss vet centers. Veterans' mental health and suicide prevention should be all of our top priority. In addition to vet centers, access to comprehensive mental health care and upstream crisis prevention are important factors in the holistic system of services available to veterans. I was pleased to see the VA recently announced that it will award another $50 million to community organizations to help prevent veteran suicide under the Staff Sergeant Parker Gordon Fox Grant Program, part of the Commander John Scott Hannon Veterans Mental Health Care Improvement Act. You know, you'll sometimes meet the spouse of a vet, and he or she will say, typically a she, I don't know where to go. I know there's a problem, but I'm not sure what to do. Well, the vet centers are obviously a place, that's where you can go. And it brings the fact that if there's a gap between the veteran and the services and their families and the mental health and the readjustment and you name it, that's what the vet center is there to do. In the past year, nearly 250,000 veterans, service members, and their families were able to receive counseling at one of these 300 vet centers. Veterans like them. Vet centers score high on the trust and satisfaction surveys, and vet centers continually succeed in building access to social and psychological services in rural areas that are more difficult for a veteran to find services otherwise. According to the written testimony from the GAO and the Office of Inspector General, there are challenges, though, at the vet center. Among these are outreach, staffing, recruitment. I'm also interested in learning how the vet centers interact with the rest of the VHA, where I have a higher level of concern about the effectiveness of the VA supporting veterans' mental health needs. I'm going to soon introduce, it's really hard even on an oversight committee to kind of know these questions. Thank you again for being here. But I'm going to introduce legislation soon called VetPAC, patterned after MedPAC and MACPAC. And VetPAC, we hope, will allow not just this oversight committee, but others to understand these interactions, these workings, in a way that will help Congress better address issues like mental health and suicide prevention. This will help us work with individuals like our witnesses in front of us today to address these important priorities. Veterans in Louisiana and across the country, along with their family members and caregivers, rely, depend, expect high-quality care to be provided by the VA and vet centers. I'm committed to working with the department on finding solutions that help the facilities and the facility staff handle sudden influxes of vets and their family members while making sure that all veterans nationwide receive the care they deserve. With that, I look forward to today's testimony, and I yield.
Thank you, Dr.